What I love about hip and knee replacement surgery is the gift of mobility we give back to people. Remaining active, especially as we age, is a key to overall longevity. Hi, I'm Dr. Kenneth Sands, a fellowship-trained orthopedic surgeon with Orlando Health. I chose orthopedics because we can see significant, life-altering results, and I can serve the people within our community. As my career has progressed, I've had the privilege to expand my horizons. I lead a team of dedicated medical professionals to underserved countries where we improve lives through surgery. By utilizing a muscle-sparing approach for both hip and knee replacements, recovery tends to be smoother and more comfortable. I train other surgeons on these techniques, as well as design implants and equipment to improve these surgeries. For hips, I use a direct anterior bikini incision. This technique traditionally reduces instability issues and scarring. The technique for knees is similar, using a muscle-sparing kinematic approach. A kinematic alignment preserves a patient's natural alignment, resulting in a more natural feel. 80% of our patients can go home the same day, and many off of all assisted devices within a month. Building a meaningful relationship with you as my patient is important to my whole team. We understand that surgery is a major event in your life, and never forget how significant and life-altering this can be.